Let me take a few minutes to introduce our today's session's resource person, Dr. Dimple Nagpal. Good afternoon, madam.
Very good afternoon.
We are very honored to have you here as a resource person, madam. And in spite of your busy schedule, you spared us your valuable time to share your deep insights. Dr. Dimple Nagpal is currently working as an assistant professor in Chitkara University Institute of Engineering and Technology, Chitkara University, Punjab, India. She has around 4 years of research experience in biomedical analysis. She has received a doctorate of philosophy degree in CSC from Chitkara University, Punjab. She has received her MTech degree from CGC Landran, Punjab, and BTech from Kurukshetra University. And more than 15 papers are published in SCI, Scopus, and UGC approved journals. And along with this, more than 10 papers in reputed national and international conferences and book chapters. And in continuation to this, she has filed 10 patents and also as one granted patent in the relevant fields. She has attended many national level FDPs, workshops, and acted as a resource person as well. She is an active reviewer in various reputed journals such as IEEE Access, Cluster Computing, IJCS, Plus One, etc. And her areas of interest are biomedical analysis, deep learning, IoT, cloud computing, software engineering, and machine learning. We are very delighted to have you here, madam. And we are waiting for your valuable insights during this FDP, madam. Over to you, madam.
Okay, sure. Thank you so much, sir, for giving the opportunity to present my my views regarding this topic. So we will start now. Am I audible?
Yes, ma'am, you are.
Okay, sir. Am I starting? I'm starting. I'm sharing the screen. Sir, is my screen visible?
Yes, ma'am, it is visible.
Okay, sure. Sure. So, very good afternoon to everyone present here. I'm Dr. Dimple Nagpal. I'm going to present on the topic biomedical analysis using EPR. So, the first and foremost thing coming to the agenda, I'll be discussing about imaging introduction, followed by biomedical imaging. Why medical imaging is important and why there is a need of image processing in bio. Yes, sir.
Your screen is not in the screen slideshow, madam. Your PPT is not in the slideshow.
Sir, my screen is in slideshow only. Slideshow manner only. Okay, I'll try once. No?
Yes, ma'am.
Sir, kindly check is it now in slideshow mode?
No, madam. It's not. It is not visible now, ma'am.
And I'll be sharing the whole screen then.
Okay.
So now?
Yeah, now it is in the slideshow, madam. Now it is fine.
Okay. Okay, sure. So, now there are various imaging modalities in ophthalmology as well as I'll be discussing it later on as well. In computer vision system, I'll be discussing like pre-processing, segmentation, feature extraction, classification, the various steps involved in that computer diagnosis system, and one case study in which I have implemented my work, detailed image analysis. So the first and foremost thing is the imaging introduction. So basically image processing is any form of signal processing for which the input is basically an image only. But how can we analyze the image to computer diagnosis? Either through set of characteristics or through parameters related to image. So basically interest in digital image processing methods stems from two principal application areas. The first one can be the improvement of pictorial information for human interpretation, and the second one is the processing of image data for storage, transmission, and representation for autonomous machine perception. So basically, image processing is such a wide field that it has so much of application areas in biomedical imaging, in computing, in secured image communication, in remote sensing, in image compression and retrieval. But for now, we'll be focusing only on biomedical imaging. So, what is exactly biomedical imaging? So, basically, it is a technique and process used to create images of the human body or parts of it for clinical purpose or for studying anatomy and physiology. Basically, it includes the analysis part, enhancement part, display of images captured via various instruments, such as X-ray images are there, ultrasound, MRI images are there, and there are various optical imaging as well. Through ophthalmology, through retinal images are there. So these visual representations can be screened either manually or automatically through computer diagnosis systems. So what exactly is medical images? Medical diagnosis can be done either through consultation, through physical examination, or through medical tests. And medical tests also, laboratory analysis like blood test, yeah, BP test is there, then biosignal analysis, and then the image analysis part is there, in which we can screen and grade the disease according to the various parameters included in the image. So, why medical imaging is important? We have doctors that can diagnose a disease, but why we are focusing on medical imaging and why we are wasting our time in doing this? Because these images that are produced by equipments are composed of pixels, and image processing mainly focuses on pixels to which discrete brightness and color values are assigned, and that can help to diagnose, treat, and cure patients without causing any harmful side effects. The first one is this. And now the computer vision can exploit these features, texture features, shape features, contour features, prior knowledge, along with the contextual information from image sequence, and provide 3D and 4D information that helps with better human understanding. It is possible for doctors to see the interior portions of the human body with extreme clarity, ease, and detail, thus facilitating easy detection and diagnosis of various diseases. And it also helps doctors to make only keyhole surgeries instead of cutting the whole hand, whole part. Only keyhole surgeries are there without opening too much of body. The doctor can diagnose it. See how much effective medical imaging is. Basically, the final objective is to benefit the patients without adding to the already high medical costs. So, there are various tasks performed in medical image processing in medicine, such as interfacing analog, output of sensors, restoration and smoothing of images, image enhancement, color correction, contour detection, removal of artifacts from the image, zooming of images, to name a some. So basically, these is a necessity of image processing in medicine. But how do we get these image processing done? There are so much of images available. There are so much of imaging modalities are there, such as X-ray images, computer tomography images, magnetic resonance imaging, single photon emission computed tomography, positron emitted tomography for specific purpose only, ultrasound images, and nuclear magnetic resonance images. These images are for the specific purpose. We have to take one modality and work on the same for diagnostic and screening and grading the disease with ease and at a very less time. So after that, these are the images of CT, MRI, nuclear, ultrasound. These are all the images of the imaging modalities. After that, how imaging modalities be incorporated in computer vision systems. So, image acquisition is done there through various imaging modalities like CT, MRI. After that, image processing is there because these devices can acquire large amount of noise due to capturing intensity, brightness. Pre-processing is required, followed by segmentation of the particular part is required that is done through region of interest as well. The feature extraction, the texture features, the geometrical features, the topographic features are extracted, and then we analyze the data and classify it on the basis of the feature extraction and segmentation purpose. So this is overall gist of computer vision system. So we'll be discussing each one in detail in the few slides. So now the first one and the first and foremost is the image acquisition. So image acquisition is a, how can we acquire the image through these devices? Either in if we want to, if we can talk about computer aided diagnosis systems. So we can take the data from publicly available data set as well. Like if I talk about ophthalmology, there are so much of data set available of retinal images. Like Messidor data set is there, ODIR data set is there, HRF data set is there, dry tears, all data set are there. However, you can take the dataset on your own. That is known as a private available datasets. Public available dataset is also known as gold standard dataset. However, private available dataset is privately available to a particular association, to a particular hospital. From and private dataset can be taken from CT scan images, X-ray images, MRI images from some hospital. There is a physical property like ophthalmoscope is there, then imaging device is there, and then we get the raw data in form of image. After image acquisition, these are the devices through which, image acquisition is, through which we can acquire the retinal images. Ophthalmoscope is there, slit lamp is there. There are so much of devices, MRI, CT scan, all the devices. After that, how can we analyze the image? There are huge amount of volume here. We can interpret according to the various techniques like feature extraction, segmentation, classification, and the most important is the pre-processing. Once the pre-processing is done in a correct manner, the classification is done, is having the more accuracy and more precise results as compared to not as compared to noisy images, and we get the output. So the first one is a pre-processing. So basically the objective of image pre-processing, image pre-processing is basically used in order to have the precise image, in order to remove the noise from the image. Basically, in clinical field, the perception of retinal images is significant for diagnosing the disease. Then the images plays a vital role to assist specialists with diagnosing many diseases, including diabetes, hypertension, and so on. But what happens is noise can be acquired through these reasons, resulting in uneven illumination, various undesirable pattern, white noise, and so on. Salt and pepper noise is there. So, furthermore, improving the image quality is an essential step before having an accurate diagnosis. So for this, we have various pre-processing techniques. I will be explaining it one by one in detail. The first one is the image enhancement. Basically, enhancement improves the pathological and retinal changes and also improves image illumination, resulting in better diagnosis of the disease. While we talk about filtering, so the objective of filtering is to remove noise. There are various techniques such as average filtering, median filtering, max minimum filtering. These are all the filters. Coming to registration, by registration, medical image registration is required when we have data of the same patient taken at different point of time, such as for detection of tumor, for tumor monitoring, for change detection. We have two types of registration: unimodal registration and multimodal registration. Now, after that transformation, image transformation can be simple arithmetic operations on images or complex mathematical operations which convert image into another form in matrix form, in negative image form, in everything. And there are various techniques such as discrete Fourier transformation, cosine transformation, wavelet transformation, and waveforms. These are all the transformations. So these are the image preprocessing techniques. So after that, segmentation. Segmentation is needed and necessary in order to attain good results. In every image analysis, the segmentation stage is crucial. But if the segmentation isn't done correctly, the rest of the steps will be complicated. So there are various techniques in segmentation as well. Pixel-based segmentation, edge-based segmentation, region-based segmentation. I have mentioned these techniques only to have your knowledge about the segmentation. After that, fecal extraction. So fecal extraction is defined as a first stage image analysis. It is followed by segmentation and classification, and it also have levels, data level, textual. These are all the features, texture-based features, shape-based features, pixel-based features, edge-based features. We can call it as label as well. We can call it as a types of feature extraction as well. So these edge-based features. So after that, classification can be done on the basis of static classifiers, syntactic classifiers, and computational intelligence-based classifier. However, feature extraction and classification can nowadays be done through transfer learning as well, in which we only have to modify the fully connected layer and we can get our results in our form. So this is an image visualization. It refers to all types of manipulation of this matrix, resulting in an optimized output of the image. So this includes all the shading, the tumor part, and the rest of the part. It includes shading, display, and reconstruction. The performance of these images can be analyzed using true positive, false negative, true negative, false positive. So the general performance measures are in terms of confusion matrix. This is known as a confusion matrix. When your computer diagnosis system done has analyzed that this tumor is correct, and actually that there is the presence of tumor is there in the image, then it is called as true positive. Same if you have detected that this image has tumor but it's not present, then it's false positive. Same with false negative and true negative. So there are list of applications. Diagnosis combining information from multiple imaging modalities. We can combine multiple imaging modalities as well, like PET and MRI in brain to actually diagnose the real problem, studying disease progression as well, monitoring changes through registration, image guided surgery or radiotherapy, image sorry, patient comparison or atlas constructions. So these are all the applications. Now I'll be focusing on case study and retinal image analysis. But before that, I want to ask, if you have any query, you can ask me. Sir, may I proceed now?
You are audible.
Okay, sure. So, coming to retinal image analysis, this is one of the this is one of the aspects of medical image analysis, and it is a very important aspect which is working on. So, diabetic retinopathy, the inability of the body to manage the generated insulin, comes under the category of leads to diabetes. And there are basically two types of diabetes, type 1 diabetes and type 2 diabetes. While type 1 diabetes is inevitable in nature and the cause is not known, the type 2 diabetes can be diagnosed using various retinal symptoms present in retina. retina, such as microaneurysms, hemorrhages, exudates. We are taking, in this particular, we are taking the ophthalmologist images. So, but when left untreated for more than 5 years or above, it can lead to diabetic retinopathy in ophthalmology. And basically, it is a condition due to uncontrolled diabetes that can lead to vision impairment. And it produces immutable vision loss revealed in adolescence and declining youth. However, it is projected to attain 191 million people by 2030. The vision loss can significantly be reduced by detecting it in the early stages. However, it can be detected either manually or automatically through computer diagnosis. But as the doctors to patient ratio is 1 ratio 10,000, it is difficult for the ophthalmologist to manually detect disease with ease and at a very less time. Then only the computer diagnosis has played a vital role in analyzing medical imaging since 1982. And diabetic retinopathy can be detected and graded according to the various morphological changes appeared in retina due to prolonged period of diabetes. And the detection of these morphological changes that includes microaneurysms, hemorrhages, exudates, optic tests is still a tedious task. These morphological changes can be defined in different categories. The changes that includes the detection of increased blood vessels comes under the category of proliferative diabetic retinopathy, while the other, which consists of detecting lesions in the form of hemorrhages, microaneurysms, comes under the category of non-proliferative diabetic retinopathy. So what I have done in my case study is what I have done in my case study is I have taken diabetic retinopathy image, I have taken hypertensive retinopathy image, and amalgamated the dataset into four parts: severe, mild, moderate, novel dataset, and the hypertensive retinopathy dataset. And then I analyzed whether the image is having diabetic retinopathy of mild, moderate, severe, or whether the image is having hypertensive retinopathy or not. So, coming to the content of stages of DR, so this includes without DR, early diabetic retinopathy, mild, moderate, severe, and proliferative diabetic retinopathy and neovascularization. Basically, neovascularization is a condition, extreme condition in which expansion of blood vessels is there, resulting in vision loss, complete vision loss. So now hypertensive retinopathy. High blood pressure or hypertension is a leading cause of the disease that affects various systems such as retina, cardiovascular, renal, and cerebrovascular systems. The damages caused due to these systems is known as target organ damage. And there are various ocular symptoms observed in retina due to hypertension, such as retinopathy, neuropathy, choroidopathy. The changes observed in retina vasculature due to hypertension is known as hypertensive retinopathy. And early detection of hypertensive retinopathy may prevent the patient from cardiovascular danger and retina microcirculation. However, the contribution of hypertension is a variation of blood vasculature as a control of blood vessel not only decreases the onset but also prevents the expansion of blood microvasculature. So, hypertensive retinopathy basically it's a disease that occurs due to constant high blood pressure and may also lead to vision loss. Therefore, a method is required which can easily detect and grade the severity of the disease at early stages. So, these are the clinical symptoms observed in hypertensive retinopathy: flame hemorrhages, cotton wool spots, papilledema, hard exudates. Tertiary bifurcation is also a parameter for evaluating hypertensive retinopathy. So this is a CAD, a computer-aided diagnostic model for retinal image analysis, in which we acquired the images, the fundus images is there, then pre-processing is there, in which I have used adaptive plate, DNN, CNN, and Vena filter, followed by segmentation in also threshold and mathematical morphology, uh, followed by segmentation of retinal veins vasculature, ground truth, and normal segmentation, in which background filtering, Prunge filtering, mathematical morphology, and connected component there, followed by transfer learning, in which I had used ResNet 101 architecture, which is a newly developed architecture, and I hope no one has used in written images for now. And the output is in form of five categories: normal, mild, moderate, severe, and hypertensive. So, coming to pre-processing. Today's technologies is exceptionally advanced that the physician can see the inside of the body through different imaging modalities. As we can say, there are various imaging modalities as well, such as fundus imaging. In ophthalmology also, fundus images is there. Then fluorescent angiography is there. There are so much of imaging modalities. We have chosen fundus images. The significant reasons involved in acquiring the retinal images through fundus camera are illumination, contrast, blurring. So noise can be induced due to these reasons, resulting in uneven illumination, blurring, low contrast. So image enhancement basically enhances the quality of the images by removing noise from the images. So these are the techniques used in image enhancement: adaptive clay, DNN, CNN, greener filter, denoise image, and performance has been evaluated using peak signal to noise ratio. These are the sample output of pre-processing. This is the input image. This is the adaptive clay. Basically, adaptive clay is used in order to enhance the contrast of the images, as original images are mainly exposed to diverse types of noise that can degrade the quality of the retinal images. For removal of unwanted induced signal, pre-processing retinal images are required. So adaptive clay is used in order to increase the contrast of color channel. DNN CNN is used to denoise the image. This network is able to handle Gaussian denoising with unknown noise level, and Wiener filter. There are various types of noise when you apply any network. Removal of noise is there. When you apply DNN CN, removal of noise is all there. But there are specific type of noise remained in medical images. In order to remove that noise, we use Wiener filter. So now segmentation. So in every image analysis, the segmentation stage is crucial. If the segmentation isn't done correctly, the rest of the steps will be complicated. And it is basically a method of categorizing data based on pixel similarity. So, when it comes to automatic classification of disease, segmentation accuracy is crucial. Image segmentation in fundus images plays a significant role in medical applications. Analyzing the progression of in this retinal vasculature is important. Segregating the retinal vasculature from the fundus images is important in order to diagnose hypertensive retinopathy. As I told you earlier, arterial to veins ratio is one of the parameters to diagnose hypertensive retinopathy. And if the arterial to veins ratio is 0.60, then it is considered as normal image. Otherwise, it is considered as hypertensive retinopathy image. Analyzing the progression of retinal vasculature is a critical part of diagnosing various retinal diseases such as DR, HR. However, manual segmentation of retinal vessels is tedious and time consuming. So basically, there are numerous methods that have been adopted in recent years by recent research by researchers for the segmentation of retinal vasculatures. These methods have been divided into two groups, namely supervised and unsupervised. Supervised approaches requires manual data annotation for optimized model. Unsupervised approaches such as morphological unsupervised approaches includes morphological processing, match filtering, vessel tracking for blood vessel segmentation. Now, for the accurate screening and diagnosis of ocular diseases such as diabetic retinopathy, age-related macular degeneration, glaucoma, hypertension, extraction of the blood vessel is important as it provides useful. conventional ophthalmologist. Furthermore, the detection and segmentation of blood vessels can also be used for diagnosing heart and brain-related disease caused by changes that appeared in routine vasculature. So this is a segmentation methodology opted. The input is the raw data image. Output of preprocessing that includes a after Wiener filter. Also thresholding has been applied. The ideal thresholding is the one that produces the minimum potential segmentation error. Oat soup is a technique that can be utilized to get optimal thresholding when compared to other approaches. Oat thresholding has various advantages, including computation speed, steady performance when paired with other methods. Mathematical morphology, basically morphology is one of the known branches of biology. The morphological operations are used to extract the various components of the image like boundaries and regions to preserve the original shape of the image. A series of algebraic operations are applied to the image, like erosion, dilution, opening, closing, and top. The morphological method is used to extract the features from an image to learn the regions to segment. Then we get the segmented output as retinal vessels, and the computation of ABR is there. So I'll be discussing the segmented output and ABR in the next slide as well. This is a sample output of segmentation. I have used, for this particular, I have used Mesidor dataset. This is the input image, this is the enhanced image, and this is a segmented image. In Mesidor dataset, there are various diabetic retinopathy images are there. So these are the images of diabetic retinopathy in Mesidor dataset. So now after that, the segmented vessels must be segregated into arteries and veins for the computation of arteries to veins ratio (AVR). The segmented vessels are classified based on region of interest. The retinal vessels inside the region of interest, that is the optic vessels, must be segregated into arteries and veins. This is done by computing mean intensities and pixels with larger values. So, two crucial parameters are there for AVR: central retinal artery equivalent and central retinal vein equivalent. So we have calculated for normal images. How can we know that this is a normal image or hypertensive retinopathy image? Through the ratio. If CRAE by CRBE means artery equivalent, vein equivalent, has a ratio of 0.60, then it is considered as normal image threshold of 0.60. If it is having ratio less than 0.60, it is considered as an hypertensive retinopathy image. So now transfer learning. Basically, now why we are using transfer learning? Because we have done with the pre-processing, we have done with the segmentation. For feature extraction and classification, nowadays we can use transfer learning. The concept of transfer learning basically is used in order to avoid the wastage of computational power for the same job. Transfer learning avoids the process of learning the model from scratch as it is already learned with other datasets. And transfer learning introduce the various pre-trained models that is only transfer learning that are already trained to work on similar kind of jobs. So these are the transfer learning approach in which earlier ImageNet is used with new initialized features and output is there 200 categories. However, in our case, we have used Mesidor and datasets, pre-trained our model, learned the weights, and the output are in the form of the normal, mild, moderate, severe, and hyper is present or not in the image. So now I have told you that transfer learning can be implemented. So there are various types of transfer learning models. The use of the CNN in image classification improves accuracy and reduces the need to feature engineer each image individually. So in transfer learning, what happens is that there are transfer learning models like LXNet, VGGNet, GoogleNet, ResNet. dense net, exception net. We only need to modify the last fully connected layer, like in this also. It's categorized into 1,000 categories. We have to classify our data set into these categories. This is the case in with these only. They have so much, they have pros and cons of their own, but you have to utilize this. You have to modify the last fully connected layer and get the result. This is the difference between building a model, CNN based model from scratch, and utilizing the transfer learning model. So, coming to the conclusion, the pragmatic issues of image generation, processing, presentation, and archiving stood in the focus of research in image processing because available computers at that time had by far not the necessity to hold. So basically, it's the segmentation, feature extraction, classification in biomedical images is continuously improved through various transfer learning techniques, through now not only transfer learning and feature extraction is possible, and transfer learning and built-in network in pre-processing is also possible. I have used in my network. DNCN is a pre-trained network only. I don't have to adjust the weights of each image. It's continuously improved and validated more accurately since validation is based on larger studies with high volumes. Thank you. Any queries?
Dear participants, if you have any queries, you can unmute yourself and clarify your doubts. Dear participants, if you have any doubts, you can ask Madam so that your doubts get clarified. Sir, it's me, sir.
Yes, sir.
Yes, Sunita ma'am, you can unmute yourself and you can ask the doubt.
Sir, I think no one has raised any doubts, sir. Sir, sir, can I close the session, sir, by closing words, sir?
Yes, sir. I hope session is clear.
Yes, sir.
You carry on.
Okay, sir. Thank you very much, madam, for your valuable thoughts about how important is biomedical analysis using deep learning, madam. And you told us the need and importance of image processing in the field of medical field. And you have clearly classified the various pre-processing, segmentation, feature extraction, and classification techniques, madam. And at the end, you have also come up with a case study about retinal diabetes and showed us the different stages of diabetic retinopathy, how retinal analysis can be taken using this biomedical analysis using deep learning techniques. Thank you very much, madam, for sparing your valuable time to share your thoughts
Thank,
as FDP, madam. Thank you
thank you
very
so
much.
much, sir. Thank you so much. May I end the session now?
Yes, ma'am. Sure. Thank you, ma'am.
Okay, thank you.